Did you know that one little-known Medicare rule, just 3 words long, could leave you with a hospital bill of $10, $20, even $30,000, and Medicare won't cover a single penny of it? If you or someone you love is over 65 and has ever spent a night in the hospital, you absolutely need to hear this. I'm so glad you're here today, because what I'm about to share could genuinely protect your savings, your peace of mind, and your future. Stay with me, this one is too important to miss. And if you find this helpful, please hit that like button, subscribe so you never miss updates like this, and drop a comment below telling me if you've ever dealt with a confusing Medicare situation. I'd love to hear from you. Now, let's get into it, and I promise, by the time we're done today, you're going to feel so much more confident and prepared when it comes to navigating Medicare. So let's start at the very beginning. Picture this, you're 72 years old. You've worked hard your entire life, paid your taxes, raised your family, and you've been counting on Medicare to take care of you when you need it most. One Tuesday morning, you wake up feeling dizzy and short of breath. Your family rushes you to the hospital. The doctors run tests, they monitor your heart, they keep you there for 2 nights, and then, just like that, you're discharged. You go home feeling relieved, maybe a little shaky, but grateful that things seem okay. About 3 weeks later, a bill arrives in the mail. You open it, and your jaw drops. It's a bill for skilled nursing facility care, tens of thousands of dollars, and Medicare is refusing to pay it. Why? Because of something called the 3-day rule. And here's the heartbreaking part, nobody told you about it when you were admitted. Nobody warned you. And now you're left holding a bill that could wipe out years of savings. This scenario isn't rare. It happens to hundreds of thousands of seniors every single year across this country, and it is one of the most frustrating, misunderstood parts of the entire Medicare system. So today, we're going to shine a very bright light on it together. Here's what the 3-day rule actually means. Under traditional Medicare, that's Medicare Part A, if you are hospitalized and you later need care in a skilled nursing facility, Medicare will only cover that skilled nursing care if you were formally admitted as an inpatient for at least 3 consecutive days. Notice I said, formally admitted as an inpatient. Those are the 4 most important words you need to hold on to today, because this is exactly where the confusion begins and where the financial danger lives. You see, hospitals have 2 ways of keeping a patient overnight. The first is a formal inpatient admission, where you are officially admitted to the hospital as an inpatient patient. The second is something called observation status, where the hospital is technically keeping you under observation, monitoring you, but you are classified as an outpatient. Now here's the thing that shocks most people, from the patient's perspective, there is often absolutely no visible difference between the 2. You're in the same bed. You're in the same room. The nurses are the same. The food is the same. But legally and financially, the difference is enormous. If you spend 2 nights in the hospital under observation status and 1 night as an inpatient, that does not count as 3 inpatient days. It doesn't matter if you were physically in that hospital building for a week. Medicare only counts the nights you were formally classified as an inpatient. And if you don't meet that 3-day inpatient threshold, Medicare Part A will not pay for your skilled nursing facility care when you're discharged. Not a dime. Now, why does this matter so much? Because skilled nursing facility care is extraordinarily expensive. We're talking about costs that can run anywhere from $300 to over $1,000 per day. If you need 2 weeks of rehabilitation after a hip replacement or a stroke, and Medicare won't cover it because you didn't meet the 3-day rule, you could be looking at a bill of $10,000, $20,000, or more, all out of pocket. Let me tell you about a woman named Dorothy. Dorothy is 78 years old, a retired schoolteacher from Ohio. She fell in her kitchen and bruised her hip badly. She spent 3 nights in the hospital, or so she thought. What she didn't know was that the first 2 nights she was under observation status, and only her 3rd night was as a formal inpatient. When she was transferred to a rehab facility afterward, she assumed Medicare would handle everything. It didn't. She received a bill for over $18,000. Dorothy had done everything right. She went to the hospital, she followed her doctor's advice, she cooperated fully, and she was still blindsided by a rule she had never heard of. Her story is not unique. It is, sadly, very common. So what can you do to protect yourself? The first and most powerful thing you can do is ask, directly and clearly, as soon as you or a loved one is admitted to the hospital, am I being admitted as a formal inpatient, or am I under observation status? Those words matter. Write them down if you need to. Put them in your phone. Because hospital staff don't always volunteer this information, and in the rush and stress of a medical situation, it's easy for this critical question to get lost. There's actually a law now, passed in 2016, called the Notice Act, which requires hospitals to notify patients in writing if they are placed under observation status for more than 24 hours. This was a huge step forward. But the written notice can sometimes be buried in a stack of paperwork you're handed when you're exhausted, scared, and just trying to focus on getting better. So knowing to look for it, and knowing to ask about it, is still your best defense. Another important strategy is to speak with a patient advocate. Many hospitals have patient advocates or social workers on staff whose entire job is to help patients navigate exactly these kinds of situations. They can sometimes work with the hospital to have your status reviewed or changed if there are clinical grounds for doing so. It's always worth asking. You should also know that if you have Medicare Advantage, sometimes called Medicare Part C, the rules can be different. Some Medicare Advantage plans have their own criteria for covering skilled nursing facility care that may be more flexible than traditional Medicare's 3-day rule. If you're enrolled in a Medicare Advantage plan, it's really worth calling your plan directly and asking them to explain their specific skilled nursing coverage rules in plain language. Don't be shy about asking them to repeat it or explain it differently if you don't understand the first time. That's what they're there for. Now, let's talk about appeals, because this is something many seniors don't realize they have the right to do. If Medicare denies coverage for your skilled nursing facility care, you have the right to appeal that decision. The appeals process can be complex and it takes time, but there are cases where appeals have been successful, particularly when patients can show that the hospital should have admitted them as inpatients based on their medical condition. Organizations like the Center for Medicare Advocacy can be incredibly helpful resources if you find yourself in this situation, and many of their resources are completely free. There's one more layer to this story that I want to make sure you know about, and that's what happens if you're on Medicare and you go directly from the hospital to a skilled nursing facility, and then your condition improves, but then later declines again. Medicare's coverage of skilled nursing care isn't unlimited even when you do qualify. Medicare covers the full cost for the first 20 days, then you pay a daily coinsurance amount from days 21 through 100, and after 100 days, Medicare stops paying altogether. So understanding not just how to qualify, but how long coverage lasts, is equally important for your financial planning. I know this is a lot of information, and I want to take a moment to just acknowledge something. Navigating Medicare can feel overwhelming, even intimidating. The rules are complicated, the language is confusing, and it sometimes feels like the system wasn't designed with regular people in mind. But you are not alone in this, and knowledge truly is your greatest protection. Every single thing we've talked about today, the 3-day rule, observation status, the Notice Act, appeals, and Medicare Advantage differences, is something you now understand better than the majority of people walking into a hospital today. As we head toward wrapping up today's video, I want you to carry this with you. You have every right to ask questions, to request clarification, and to advocate for yourself or your loved ones in a medical setting. You've earned your Medicare benefits through a lifetime of hard work, and understanding how to use them fully and wisely is not just smart, it's essential. Coming up, I'm going to leave you with a few final, practical takeaways you can use starting today, simple steps that could save you thousands and give you the peace of mind you truly deserve.